switch gears and talk about health care, which is such an important issue to millions and millions of Americans right now. Under the new health care law that was recently signed into law by the president, children now can stay on their parents' insurance policies until the age of 26. People can no longer be denied coverage for pre-existing conditions. Insurers, the big insurance companies, are prohibited from rescinding coverage if a customer becomes sick, and they can't impose any lifetime limits on essential benefits like hospital stays or expensive treatments. You say you want to repeal all of that?
Well, first of all, no one's disputing that our healthcare system before Obamacare didn't need reform. Those are very important things that are part of insurance reform, not healthcare reform. In the course of the public debate over healthcare reform, we've begun to confuse coverage with care. Our goal should be to make health care more affordable. Even with Obamacare, our most vulnerable in Delaware are still left uninsured and still left without access to quality health care. When we passed Obamacare, we were promised that it would make more people insured. Well, recent CBO reports say that it's not. It's actually causing businesses to drop their policies because compliance standards are so high. Our laws, especially when it comes to health care, should not force businesses to break our laws. Second of all, we were promised that more people, that healthcare costs would be lowered. It hasn't. It has increased healthcare costs, according to recent reports. So what I want to do is to fight to fully repeal that so that we can begin to enact real reform. And that real reform would include allowing policy portability when you change jobs, allowing Delawareans to get policies across state lines. Right now, we only have 3 options. That's not right. And I would also fight for some sort of tort reform that allowed doctors to not have to worry and practice medicine to prepare for the courtroom as opposed to the examination room. But at the same time, this tort reform has to protect those patients who are victims of true medical malpractice.
You have 1 minute to respond.
So much to say. I support the implementation of the Affordable Care Act. I think it made significant advances, and you outlined many of them. But there's additional investments in the bill to make sure that there's a breadth of coverage to rural areas through the Health Services Corps, by recruiting and training a whole new generation of doctors and nurses, by expanding support for community health centers, and by also improving the efficiency of our healthcare system. It makes a landmark investment of $350 million over a decade to try and fight waste, fraud, and abuse and to increase those savings. And there were strategic investments in electronic medical systems that would allow electronic medical records to reduce injuries to patients, mistaken diagnoses, and mistaken treatments. All of these in combination, I think, argue for extending, perfecting, and implementing this landmark bill. It's not perfect, there's problems with it, but I think rather than turning it back and repealing and going for another year or 2 of endless partisan bickering, this was a critical piece of legislation. Not a pretty process that passed it, but I would stand for it and implement it responsibly.
Well, we're now into the part of the discussion on it, so let me just ask you that the issue was brought up about malpractice reform. And Democrats are often accused of being too close to trial lawyers, and Republicans say that's why that there has not been the opportunity for reform in this area and why it was not included in the health care bill. If you were elected, would you work to amend that bill to include malpractice reform?
I think it is critical that folks in this country be able to stand up to and take on powerful interests, and where individuals are harmed, that they're able to go into court and to seek redress, whether they're harmed by someone who misled them in a securities investment, a product that they purchased that hurt them because it wasn't designed or delivered right, or a medical procedure that went horribly wrong. I don't support putting caps on liability because I frankly think in our current system, it is only the threat of a significant recovery that allows protection for consumers, for patients, for investors. I frankly think that's an important part of the American legal system. I do think, as I just mentioned, there's significant advances in this bill that allow us to make healthcare safer, stronger, more transparent. And if I've got a major concern about this bill, it's that we're going to reduce costs without squelching innovation. Delaware and this country has made incredible advances.
It is discussion. Okay, that's what I was trying to, okay. First of all, you say that you're concerned about reducing costs, but reports have showed that this health care bill has caused costs to skyrocket. Second of all, you say that it's partisan bickering, but 1 out of 4 Democrats have gone on record saying that they oppose Obamacare. They've realized that we made a bad mistake. And what this bill does is it gives a massive government control over health care. Uncle Sam has no business coming in the examination room, coming between you and your doctor, and that's exactly what this bill does.
Give some concrete example of how. That's a great slogan. You toss it around everywhere you go. But how does this bill actually put Uncle Sam in the examination room between doctors and patients? And if so, why did the organization that fights for and represents America's nurses, America's seniors, America's hospitals, and America's doctors all endorse and support this bill?
And many of those branches on the state level, including here in Delaware, have said that we don't support what the national office has done. It gives the government the ability to say what kind of treatment a doctor can and can't do, what kind it will fund. It forces businesses to have to comply to these standards, where many businesses, especially here in Delaware, have said that they can't afford to it, and it's cheaper to pay the non-compliance.
The State Chamber of Commerce...
And it's also cut, this health care bill has cut Medicare.
Let's get this point out, because we're down into the last 30 seconds of this discussion.
I was just going to say the State Chamber of Commerce and Christiana Care hosted a debate earlier today. I was sorry you chose not to join us. It would have been great to hear the response of the physicians and the nurses and the hospital administrators to your suggesting that they didn't support a bill they lobbied for.
I want to be precise on this specific healthcare related issue. You oppose the government mandating that everyone must purchase health insurance. Is that right?
Yes, because we're confusing coverage with care. Our goal needs to be to make health care affordable.
All right, well, here's the question. Let's say someone decides not to purchase health insurance, makes that conscientious decision, even though this person can't afford to buy health insurance, but doesn't want to. This person gets critically ill, is rushed to an emergency room. Should we, people who pay for health insurance, provide him or her with that kind of treatment, or should we kick him out of the emergency room and said, you made a decision, you're not going to get this kind of treatment?
If we do the things that I said that will help to address, that I'm proposing, that will help to address the issue of health care, then that person can afford to buy a catastrophic only policy from across state lines. They'll be able to...
But what if that person doesn't want to buy it?
Well, then we have to address that.
Who should take care of that person in an emergency?
We have to address that.
Would all of us taxpayers have to pay for that person?
Anything that they do when they have another bill that they can't pay, make them pay it. Hold them accountable for that.
Before or after they get care?
Right now, well, that's up to the hospital. But right now, we're forcing them to. We're forcing them that they have to give care to illegal aliens. So this is something that we're already doing. What I'm proposing, you're also talking about a very small hypothetical using scare tactics to make people support this health care bill. What I'm proposing and the health care reforms that I'm proposing will help address those situations and help alleviate those situations.
It's not such a small number.
It's not a small hypothetical.
Well, nobody should be forced to pay for anyone else's health care, and that's what Obamacare is doing.
And that's what's happening today. Before the health care reform bill passed, all of us who have health insurance, who have health coverage, have been bearing the costs, paying the freight for those who don't have insurance and who don't have coverage. They're getting health care through emergency rooms now. That's partly why small businesses, employers like Newcastle County, have faced double-digit increases in our insurance costs year after year after year, because that's how we provide care now. It's inefficient, it's inhumane, and it's not effective.
We have to park this issue for now and move on to our next topic.
Agree with me that Obamacare should be repealed.
All right, let's move on to immigration right now, and this question will be from Mr. Coons. A pathway to citizenship for illegal immigrants. You support that, right?
No. I support a pathway to being here legally. And let me take a moment. Was that your whole question, Will?
The question is, what is your position on a pathway to citizenship for illegal immigrants?
We've got roughly 12 million illegal immigrants in the United States today. This is a huge problem. And immigration is a federal responsibility. And I think we should look to the federal government to step up and fix it. The federal government has failed states like Arizona, like Delaware, like many others. But we need to recognize the situation we're in. There are whole industries that rely on the labor of those who are here illegally, and there is a long tradition of failing to deliver the border security that our country needs. The current administration has stepped up and invested millions of dollars in additional troops, in additional services, additional support at the border. My path forward on immigration would be strengthen the borders, make it much tougher for folks to come here illegally and increase the penalties when they do. Second, hold employers accountable, particularly those who routinely employ folks who are here illegally, by giving them real ID that can work, that is much more difficult to counterfeit, and then holding them accountable if they repeatedly violate that by employing those who are here illegally. And then allow those who are here illegally and do not commit further crimes to come out of the shadows if they will pay taxes, learn English, pay a fine, say, I committed a crime, and pay a fine, and go to the back of the line behind those who applied to come here legally. I would give them a path towards legal residence. I think there's more they'd have to do to ever earn citizenship. I respect the tradition of those who go and serve our nation overseas, for example, being offered a chance at citizenship. But in my view, the pathway I'm suggesting is one towards legal residence. I want to see us focus our resources, law enforcement resources, on finding and deporting those who pose a real threat to our community. As someone responsible for a county police department, I've seen over and over instances where neighborhoods are threatened by people who are here illegally and where the ICE does not have the resources to deport them when we deliver them to them. That should be our top priority.
Again, he's backtracking on things that he said earlier on the campaign trail. And I would ask you, when you say that you support border enforcement, this administration recently stopped the efforts to put a virtual fence on our border. When Barack Obama is standing with you on the campaign trail this Friday, are you going to tell him that you disagree with him on his immigration reform efforts? I believe, however, that securing our borders should be our first priority before we get into any discussion of whether we're going to give Social Security benefits to illegal aliens. America is a magnet for those all over the country who do believe, or all over the world, who do believe that America does stand as a beacon of hope and justice for the world. And therefore, I support a legal pathway to those who are coming over here, especially for political asylum, to seek a better life than they do in our country, and to reward those who break our laws is to cheat those who honor them. And this is not a message that our federal government should be spending.
Let's go into the discussion portion of it, because you say that you agree to the pathway to citizenship.
For legal.
But you don't want to provide amnesty.
I don't want to provide amnesty.
How can you do one without the other?
Because what I'm saying is we have to get rid of all the bureaucratic messes that make the legal pathway difficult. But when someone willingly breaks our laws, that sends a message that don't worry about the laws that we've set up. Don't worry about those who are on long waiting lists for political asylum. Break our laws and we'll grant you these benefits. It's sending the wrong message. It's economically hurting us, and it's also a national security issue.
Ms. O'Donnell,
but I do support responsible guest worker. I do support responsible guest worker programs, and that's the difference.
If you can reconcile all those comments, you're an even more talented reporter than I think you are, Nancy. One of the challenges that we face is getting past the endless bickering and the partisan divide on this. Senator John McCain was someone who, before this election cycle, had been a real advocate for working with the business community, working with Democrats in Congress to find a path forward. As the years and years have rolled by, the number of folks who are here illegally and who pose real threats to our community continue to grow, and we are not taking the actions we need to take to separate those who are willing to pay a fine, to accept responsibility for coming here illegally, and to begin paying taxes and contributing to our community and the benefits that they're earning. I would rather have us begin to provide a path so that those who are here illegally all stand up and take responsibility for that or are deported. That way we can make progress.
Wow, he just took a hardline position. Again, I would ask you, are you going to tell President Obama that you disagree with him and you think that illegal aliens should be deported? But we have to keep in mind that when we tried amnesty in the 80s, it backfired. It only increased the problem. So we've got to address the issue of securing our borders, and this is something that President Obama's administration stopped this year. We've got to secure our borders first, and then begin the discussion on guest worker programs and how to eliminate some of the bureaucracies that keep the legal pathway to citizenship so difficult.
We're going to get to student questions in a moment. We're going to get to another question that I have, but I just want to clarify one thing on the national security front on China, which is a huge issue right now. In 2006, and correct me if I'm wrong, you said that China has, quote, a carefully thought out and strategic plan to take over America, and if they pretend to be our friend, it's because they've got something up their sleeve. You also said you wish you weren't privy to some of the classified information I am privy to. I'd like if possible, for you to clarify what you meant.
Well, first of all, I was